My name is Maddie Ablitz. I am an occupational therapist and owner of Threshold Therapeutic. I am here today with some wonderful community partners at CareWorks Mobility in Charlotte, North Carolina, to talk to you about our topic today, that is, what is a sit-to-stand? A sit-to-stand lift is a device that is designed to help someone go from a sitting position to a standing position, hence the name sit-to-stand. These are designed to help people who are either unsafe or unable to do this on their own, and where the burden is on the caregiver who may be doing more lifting than they are able to or want to do. So this is designed to take that burden and make the process safer. Before I show you how a sit-to-stand works, I want to take a moment to talk to you about who a sit-to-stand lift is appropriate for, because there are a few key things that you want to think about. Sit-to-stand lifts are designed for people who are able to comfortably and safely bear weight through both of their legs. Someone who has chronic knee pain or who is non-weight bearing or has a lot of hip pain and standing may not be appropriate, because this device is going to put all of that weight on feet, knees, and hips to help them maintain that standing position. This is also going to be most appropriate device for someone who has good trunk control. When I say good trunk control, I mean that the person you are using this for is able to sit on the edge of the bed with very little to no assistance, meaning if no one's around, this person is not going to go falling off the edge of the bed. We need to have trunk control to maintain a safe position. This is also going to be most appropriate for people who are able to follow directions and cues through the process. So if your loved one has a significant cognitive impairment, or they become combative or agitated during a transfer, this device is not going to be the most appropriate choice for that. So now that I've given you some insight, I'm going to go ahead and show you how it works. So I'm going to bring in my assistant, Morgan. Morgan is coming in a wheelchair, so I'm going to show you how we would get someone from a wheelchair to the bed using this device. So we want to make sure our wheelchair is locked, and I'm going to get Morgan ready to go by removing these footrests. The first thing that we have already taken care of is putting the sling device on. Sit-to-stands have a sling that's very basic. It is a strap that looks kind of like a seatbelt that wraps around the waist, gets buckled tight as low as it can go, and we have two straps right here that are going to hook on this device and help her stand up. So the first thing I am going to do is I'm going to take the legs of my sit-to-stand. I'm going to move them into a wider position to go around the wheelchair. I'm going to do that here with this lever on the back. And I am going to position this device in front of Morgan, having her watch her feet. Her feet are going to go on the foot plates that are down here, and I'm going to get this as close to her as I can so it touches her knees. And I am going to lock this device in place. I'm going to go ahead and grab the loops on my sling. The positioning of the loops is going to depend on how upright you want that person to be. So the more upright we want them to stand, we hook them on the loops that are closest to the body. If you want them leaned back a little bit, we go to loops that are farther from the body. You want to make sure that those colors match on both sides. So now this particular sit-to-stand happens to be fully electric, which means with the press of a button, I'm going to help Morgan go from a seated position to a standing position. There are non-electric models available, which are typically operated by a hydraulic manual crank that you can pull up and down, but the concept is the same. One thing that we want to make sure when we're using this sit-to-stand is that the patient's arms are on the outside of the sling. If they are on the inside of the sling and I go to have Morgan stand up, it's going to pull her body forward, and we're going to smack our head right here on this rock hard metal piece. We don't want that to happen. So client's arms on the outside, they can hold on to the sling, they can hold on to several different hand holds as long as that sling is going under their underarms. Once we are ready to go, I'm going to go ahead and have her stand. As you can see, as Morgan is standing, she is putting in no effort. This machine is doing the standing for her. One of the benefits of this sit-to-stand is that if at any point Morgan actually wanted to kick some strength in with her legs, she can help this machine go into a standing position, and it's not going to cause any harm. It's still going to give her the ability to use her legs as she wishes. Once I get them upright as far as I want, this machine is going to keep her in this standing position until I get to where I want. if her knees buckle. If she's not strong enough, even if she buckles her knees, this foot plate at the bottom is going to catch her and she is not physically capable of going backward or falling. One thing to mention is that this sling under the armpits, though, the more we hang down and buckle our knees, it does over time start to dig under that armpit. We want to make sure that that sling is buckled nice and tight low on the hips. So now that we're up, if I wanted to get Morgan into bed, I would simply unlock my brakes. I would back her up. At this point, if I need to, I can take those legs and I can move them to a more narrow position to fit under the bed. I'm going to turn her and line her up so that she is exactly where I want her with legs touching the bed. And I'm going to go ahead and grab my remote and lower her right back down. All right, once we are down and settled and lowered, we can go ahead and loosen those straps. We can unbuckle that sling, and then we can help Morgan lay back down into bed. For more information, please feel free to check out our blog and our website for some articles and tips and tricks on use of lift devices. Thanks so much for watching the Home Care OT. Please like and subscribe to keep up to date with our video content, and head over to our blog linked below at thresholdot.com.